Okay, so they're filtering back in from that, and we'll knock out this little chapter this morning. I did post the study guide for the cardiology test. Look at a calendar right quick. Give you a date.
When does it need to be done?
I'm just going to give you a date. We'll just do it in here.
I don't have time to spend I was stressing about that. It's like, man, I took a whole day to work or something.
Well, I need to test it though.
I prefer a paper test.
Yeah, I can't do that. I prefer it too.
That's fine.
But I do have to test it because if it goes online, that's how we'll be doing it. So, how about the 2nd? How about next Wednesday?
In here?
In here.
Okay, yeah, that's fine.
Cannot believe it's October.
Yeah.
All right, allergies and anaphylaxis, right? Okay, good. This is relatively quick chapter as far as your textbook's concerned. I do anticipate it taking the class period to do it though. So let's get through the objectives right quick. And we should come up to something about A and P. Yeah, A and P of the immune system. Where to start?
I think Riley was the last one. She's not back yet.
Yeah.
She was like one of the last ones in the line.
Well, Amber said she was the last one.
Oh, was she?
Unless she's in the restroom. I said I didn't see anyone around me. I said I think I'm the last.
Okay. All right. Well, they'll catch up. The body and its immune system is probably the most, I would venture to say, least understood body systems because it's just so complex and we can't necessarily see it. We have to measure it. And how do we measure it? Well, are you sick or not? Do you fight off infections? Do you fight off germs? And that's going on nonstop. And you got to understand that it's not all you. We have a microbiome on our skin and in our gut that help us in that. You know, if it wasn't for that microbiome, it would overwhelm our immune system. So, you know, to build into this, I need you to consider that. I need you to consider that patients who are taking antibiotics, antivirals, those medications that kill the bacteria, even though they're potentially good bacteria, they get destroyed through the use of antibiotics. And it gives rise to infections like C. diff and MRSA, often known as MRSA, which is a methicillin-resistant Staphylococcus aureus. You can just call it RSA now because it's even resistant to things that it wasn't resistant to 2 years ago. So the people who are building antibiotics are always looking for the next best thing to work, and we're pretty much getting to the point where the bacteria and the viruses are outrunning that. There are some infections like C. diff that there's such a certain strain of them that they can't be killed with antibiotics, and we have to kill them with good bacteria, and we have to go find those good bacteria, and that's why we need stool donors to poop in a bag and give to somebody else. So we can have those we call them fecal transplants. And you'll get around people with C. diff and all these different things. So the immune system is crazy amazing, but it's also at the same time failing. to some degree, and we're to be at fault for some of that, unfortunately. When I say we, the modern medical world is at fault to some of that. We're going to get into today some of the issues with, I don't need that thing buzzing in my pocket, issues today with people who either have too much immune system or not enough immune system. The not enough immune system causes our chronic diseases like you had a liver transplant and now you're on immunosuppressive drugs so you won't reject it, and they're prone to diseases, and we deal with that disease. Today's topic, though, is the other way. We have an immune system that's too strong and it's fighting stuff harder than it should or needs to. And it seems like today we have more and more and more people allergic to different things. So a couple of key words that I'll start throwing out here today. The first one is a protein. And you're accustomed to that word because all of us, it's one of our macros, and we eat proteins, and we need protein for muscle growth and development and amino acid construction and things like that. But it's identifiable. These proteins have what we call markers. And it's these markers on these proteins that your immune system recognizes. And it recognizes them as friend or foe. If your body says that's an enemy, then it goes attacks anytime it sees that protein with that marker. You could say that is now your antigen. That's the name given to the protein that causes the problem. For example, latex. Latex comes from a tree, a rubber plant. They take the sap and they process the sap and make latex rubber out of it. Got something flying around?
Yeah, it's a fly.
A fly? Bee venom has a protein in it. Peanuts have a protein in them, but they're identifiable by the markers on the surface of these antigens. When we take a immunization to fight off something in the future, you've had your shots, so to speak, we introduce that antigen to stimulate the immune system. And then if they ever see the real thing, we know what to go fight. And so a couple of other things, I wish you'd kill that thing. A couple of other things, and you heard this we started hearing this a lot during the pandemic, T cells and B cells. And these layers of immunity, if you will. So let's just kind of do some high school biology here. What's the first layer of immunity to the human? Skin? And the microbiota that are on the skin? Yeah, that's the first layer of immunity. It just keeps it away from us. What would be that next layer? Stomach acids, secretions, mucus, things that flush. Our eyes water, our tears drain, our nose drains, we swallow saliva, we swallow the snot that's out of our nose every time, and that goes down in our gut, and that stomach acids kill the pathogens. If they make it through there, then the gut microbiota work on it. About 60% of your immunity comes from your gut. And so that's why you need a really, really healthy gut to stay healthy, is to keep those microbiota fed. And then what happens? And what if it makes it through there? What if the pathogen makes it through there?
White blood cells or something.
Okay, so we have these very basic, when I say basic, we have these, white blood cells, we have these macrophages, and they just go clean up stuff that looks foreign to the body. And you could say that they're kind of like the infantry in the military. It's just, nobody's specialized, it's just a large mass of things that goes after something. And then we can get super specific if we go to that next layer, and that's your T cell immunity. And T cells are like the special forces. They're trained to go after one specific target. And before they can go to that target, they have to see it once. And we call that first exposure. So your immune system has to see the pathogen at least once. It doesn't like it, and it says, hey, I've never seen this before. We don't have any special forces, if you will, to go out and get this. So we need to go train those. And T cells and B cells both originate from pluripotent stem cells. Pluripotent stem cells. And these pluripotent stem cells are kind of generic at the moment. You can just think of those as the new enlisted person in the military, the new recruit in basic training. They can be anything at that moment, right? They haven't went off into their little specialty divisions. So some of these stem cells go to the thymus gland, which is a gland that's in the center of your chest, and that's where they get specifically trained. So the T cells are trained in the thymus gland. The B cells, they are trained in the bone marrow. They are trained in the bone marrow. But the point of this is, for that training to take place, or that development to take place, I use training because of the military anatomy analogy, but for this development to take place, they have to see the substance once. So we'll use the peanut allergy as an example. A person's allergic to peanuts. The first time they eat peanuts, nothing happens. Nothing happens. Their body may not like it, and if it doesn't like it, it will tell the T cells and the B cells to develop to go fight that antigen the next time it sees it. So the second time they eat peanuts, that's when the immune response will be mounted, and the body can't wait to just go attack those peanuts. Yes?
Why does it do that?
Why does it not like it?
Doesn't like peanuts, yeah.
If you find that answer, you'll be you'll get the Nobel Peace Prize in medicine.
Okay.
There are many theories.
Because there has to be a reason if the number's going up.
There are many theories. Is the antigen look like something we can eat now? We already know peanuts weren't really, I mean, you can't eat a raw one, your body rejects it anyway. Is it a new peanut now? Is it the glyphosate that's sprayed on these things? Is it the herbicides, the pesticides? Is it the genetic modification of the peanut? Is it these kids are growing up in the sterile environment now? They're not eating dirt. They're not playing in the dirt. They're wiped down with antibacterial soaps, and the first sniffle they get, they're off to the doctor and they want an antibiotic, and they're pissed off if the pediatrician won't give it to them. I mean, we could go on and really get into a rant here and go, well, yeah, all that. Yeah, all that. But that's not making light of the fact that it exists.
Yeah.
And I'm using peanuts. Anything with a protein can cause that. Maybe it's because we're overexposing ourselves. I don't have a latex allergy. But in the 90s, AIDS got real, I don't want to use the word popular, but the AIDS pandemic, epidemic kind of started really peaking in the late 80s. I told you the story. We used to have a box of gloves in the ambulance last 6 months. We just didn't wear them. And then we got to wearing them all the time. Everybody was afraid of AIDS. You know, we're going to catch AIDS by just looking at somebody with AIDS. That's how silly we were. We were wearing gloves all the time. People started having protective sex, wearing latex condoms. Now there's this big latex allergy that was so pronounced that now all medical institutions are latex free and all that.
It might be like overuse of
Yeah, it's just overexposure. I noticed that I was starting to break out in a rash on my hands after wearing latex gloves. But I don't have per se I have a latex sensitivity. Not a major event. There's a big difference here that you need to come across and understand, that we're all allergic to bee pollen. I mean bee stings, bee venom. if any one of us in here gets stung by a bee, we will have an allergic reaction. I can almost guarantee you. That reaction will be local, most likely, at least. There'll be a raised whelp where the bee stung you. It will itch, it will do its thing, and that may be all that happens to us. That's what would happen to me. There may be one of you in here that gets the bee sting, and instead of it being a local reaction, it's a systemic reaction. And those are the ones where the EMT gets involved, or the paramedic. It's the systemic reactions to this kind of stuff. But remember, it doesn't happen on the first exposure. It happens on the second. Another thing that you're going to encounter, who defines allergy? Well, you define allergy. As an EMT, what's an allergy mean to you? What's it mean when someone's, I'm allergic to bees?
The body rejects it, or the body takes it a different way.
Okay.
I need that.
What's it mean? Let me simplify it or change it. What's it mean to be allergic to poison ivy? Do what?
Have a little bit more than just a rash.
Well, but what if it is just a rash? Is that not an allergy too?
You have a more excessive reaction.
You have a systemic reaction.
So
Something that changes the
when
homeostasis.
yeah, it's disrupt. It's, yeah, but when do I worry as a paramedic or an EMT? Do I worry about a rash? No.
The throat starts closing.
Okay, so airway collapse, cardiovascular collapse, and do y'all know the word for that? Huh? There it is.
What is it about poison ivy that makes people have a reaction to it?
The urushiol oil, it's a Japanese word for the oil that's on poison stomach, poison oak, poison ivy, and your body just doesn't like it. It's a plant defense mechanism.
Yeah.
The plant says, I don't want you around me.
Yeah. I was curious because like me and my grandma and I think her grandma, it just doesn't affect us at all.
Okay.
At all. I didn't know why that.
Yeah, you just don't mount an immune response to it. There are some people with poison ivy, maybe not this bad, but it depends on how they got exposed to it. If it's exposed through smoke, I've seen people have airway issues because the poison ivy was being burned in a brush fire. And down to the wheezing and stuff like that. I don't know of anyone, I'm not saying it doesn't happen, but I just don't know if, I haven't heard of, that doesn't mean it didn't exist, of someone having cardiovascular collapse with poison ivy. But yeah, that's an example of we have a varying of allergy. If I get exposed to it, I get a little itchy on my fingers where I touched it. My wife's so sensitive to it, I can just put the clothes in the laundry and with her clothes, and sometimes she will break out and say, like, how did I get poison ivy? I wasn't even out there. It all mingled in the room. But I also have people in the family who think that poison ivy is contagious. It's not contagious. It's not contagious. The only way you're going to get poison ivy for someone else is if they have oils on their skin and you brush up against the oils themselves. It's not contagious. But that's what we're worried about. When we say allergic reaction, this is what I worry about. When I ask a patient, are you allergic to any medications? And they say, I'm allergic to Benadryl. Why? It makes me sleepy. It's not on my slide here, okay? If they say, I'm allergic to morphine, I can't take morphine. You go, well, how come you can't take morphine? What's it do to you? If they say something that involves obstruction and cardiovascular collapse, do not give them morphine. If they say it makes me drowsy, it's a side effect. It's a side effect. My daughter is allergic to penicillin. Has she ever taken penicillin? Once. And the second time she took penicillin, she broke out in a rash. No more penicillin. Because what would the third time be? It could be this. People who eat shellfish, they're allergic to animals from the ocean, if you will, the fish from the ocean. I love shrimp. First time I ever had shrimp, I'm going back to Joe's Crab Shack next weekend and eat it again. And then they go back down there and, it may take them longer than a week to build a defense, but they go down and eat it and they're sitting at the table going, what happened? I could eat this a month ago. Well, we mounted a defense against that specific antigen that's found in those fish. and that's that protein there. So this is what I want you to look at. If you have both conditions here, the word is called anaphylaxis. The word is called anaphylaxis. It's the title to the chapter, anaphylaxis. Well, guess what the short-term fix for that is? Epinephrine. Epinephrine. Without epinephrine and we have cardio and airway collapse, we will end up with a dead patient without it. By the way, this is posted. So let's look at this slide right here. There's a lot on this slide. So I'll just start with the word mast cell, or the two words mast cell. The mast cells are, if you will, the heart of your immune system. They're located throughout the body. We're having one of these right now, aren't we? Is it peanuts or is it shellfish? Dust, perfume. So the mast cells. The mast cells have all these chemicals inside them, these leukotrienes and the like, and they hold them inside. They're like little capsules, if you will. And they hold all these chemicals inside that capsule. When activated, and in this example, I think we have a bee, don't we? And there goes the antigen. The antigen comes out of the bee venom, and it's in the bloodstream now. And the mast cell says, open up. Jordan, would you say we had a name for that? I don't see it on the screen. That's called mast cell degranulation. It degranulizes. If you think of all the granules being held in, all the granules spill out. What are the granules? The chemical mediators. So let's just kind of go around and look at some of these stored chemicals. Specifically, you're going to be looking at things like histamine, leukotrienes. Histamines and leukotrienes. There's also some heparin that's released. Basically, these chemicals are meant to contain the poison or the antigen into a specific location. So back to my bee sting on the forearm, I got a localized reaction. Is it going to be hot?
Yeah.
It's going to be hot. Is it going to be reddened? It's going to be red. It's going to swell. It's going to get edema around it. And that's normal and good because it's containing the venom or the poison or the antigen to that local area. In a person who has a hypersensitivity to that bee sting, meaning they have a systemic reaction, all the mast cells through the body degranulate. Like the ones in the lungs. Well, when it does it in the lungs, what do we get? Bronchospasm, vasoconstriction. Not what we want in the lungs. Makes it hard to breathe. The lungs start swelling. They get a lot of mucus in it. Almost looks like asthma, doesn't it? Almost looks like asthma. What's the heart do? It slows down, doesn't beat very hard because of the degranulation around the heart. The blood vessels, they dilate and leak. We know from our shock lectures that we don't want blood vessels dilating and leaking. This is why these people swell and get edema and their eyes swell shut and their tongue swells and all this stuff. The skin, 3 new words for you, or at least 2 new words. Pruritus and urticaria. Basically, that's hives. It itches and it's hives. It's blotchy. Not just at the local area, hypersensitive person, this is all over the body. Their throat itches, their eyes itch, their eyes water. They're building too much mucus in the lungs. What chemicals are causing that? Histamine, leukotrienes, and heparin. And heparin causes your vessels to leak. That's why epi works. Epi is a pure, remember the word, sympathomimetic. Does it have alpha-1 properties? Is it positive alpha 1? Epi is positive alpha 1, isn't it? So we're going to take care of that with epi. Is epi beta 1? We're going to take care of that. Is epi beta 2? We're going to take care of that.
What's that second word on blood vessels?
Leakiness. So epi seems to be a great fix, and it is a great fix to wipe these symptoms out. What's the problem with this, though? What's the shortcoming?
Not a long lasting.
Yeah, it's fast on and fast off. It means it's got a really short half-life. Epi does not prohibit the degranulation of these cells. And I told you one of the key players, one of the key chemical mediators right here, one of these bombs, as described here, is histamine. What do you think this anaphylactic patient needs after the epinephrine? An antihistamine, and a great one is Benadryl. And the other word for Benadryl, or the chemical name for is diphenhydramine. Generic name is diphenhydramine. So the epi stops the immediate life-threatening shocky look, and the Benadryl goes in to prevent the histamine from causing problems. And this Benadryl is given until the body can kind of get a hold of itself and the toxin gets flushed from the body.
How is Benadryl given in the ambulance?
IV or IM. But we don't do that as an EMT. As an EMT, we can just assist someone with their EpiPen, or if we have a protocol to draw it up and administer it. So does an anaphylactic patient warrant ALS intervention? Yes. So the first immediate step in treating someone with anaphylaxis should be the administration of epinephrine in however form you can get it in them. Your next best option is to call ALS if possible. If not, transport and be ready to do what with epinephrine? Repeat it.
Well, you can't titrate epinephrine as
I can.
Yeah, a paramedic can.
Yeah. And I don't say that to brag. Don't take that out of context. That's not what I meant. I'm saying that now you know that's the job of the EMT, is to know where the resources are that this patient needs. And if I get a paramedic here, I maybe could titrate this in there. That would be a rarity. But it can't happen. If you just can't get it to stop, it just keeps going and going. And maybe it's an ingested antigen. If you get it ingested into the GI tract, it's just a constant exposure. You know, if you got a bee sting, you pull the stinger out and you're good. You're no longer exposed to it. But if it's in the gut, like a gluten sensitivity patient or something like that, man, that makes it hard. Because you got to flush the GI tract.
Would there be a chance that like the allergic reaction would cause the body to want to flush it?
Oh, absolutely. Because you know what the slide's not telling you here is these patients also get nausea, vomiting, diarrhea.
Yeah.
These anaphylactic patients often just have a severe bout of diarrhea because the body's trying to flush it. And it's a mucousy diarrhea because the stomach mucus comes in there and it's just wanting to take any pathogen it can find and exhaust it and get it out of the body. So we may have to add other drugs for that, but careful on stopping diarrhea because that's the body's defense mechanism. We mention these because these are the immediate life threats. Diarrhea would take a little longer to kill you. Not that it couldn't, it could. So here's a picture of those hives. And you'll see this word probably on your test, not hives. So these are popping up. Severe anaphylactic reactions, these may be all over the body. This reminds me of my little girl after the second time she took penicillin. And I knew what it was. You know, I knew that she was having an allergic reaction to something. But some kids are allergic to the detergent they're using in the laundry. They're allergic to the dryer sheets. My wife's a dryer sheet fan. I am not. I don't use them. There's no need. It's just a marketing thing. But dryer sheet, pretty stout chemicals in a dryer sheet. And it goes back to what your question was, Sterrett. We're exposed to so much. Who knows what the cause of these reactions are? I told you yesterday about the guy with the baby and gluten in the diapers, right? Gluten in the diapers. But that's an example of what hives look like. Now, if you arrive on scene and this is all that you see, don't just say, well, it's just hives and you probably need a Benadryl cream and you'll be okay. You've got to move this patient and stay with this patient, because this could get worse. You may be catching this in a very early phase. Look at that. That has a name, and it's called angioedema. Angioedema. The textbook is a little off on this. When I say a little off, this isn't anaphylaxis. Is this an airway obstruction? Yeah. Okay, it is that. Let me grant you that.
Is there an allergic reaction to
Lisinopril, a very, very common blood pressure medication. It's a pril. It's an ACE inhibitor. Do y'all know of anybody in your family? I don't know that necessarily your age group is taking lisinopril, but if you may know someone in your family who takes lisinopril and they have what's known as the lisinopril cough. It's just it's a side effect of taking an ACE inhibitor, and most people who take lisinopril will have that little cough. They're not congested. It's called the lisinopril cough. It's a side effect. So we know it's having some effect on the airway anyway. Now, people of African American descent have a greater sensitivity to lisinopril. And the sensitivity includes angioedema, that swelling to the tongue and the lips and the face. It is an airway issue, but it's not anaphylaxis.
How do you get rid of that?
Time. You just got to get it out of the body. But what's the problem? I mean, you can still do your Benadryls and stuff like that, but what's the problem with this? You've ingested it, and it's got to clear from the system. And
we just watch it, and the moment it started closing up the airway, we didn't do it.
Mhm.
Just wait.
It's just time. It's just got to get out of the system. And then your medical chart says you can't have lisinopril anymore. What are you allergic to? I'm allergic to lisinopril. That ought to come up. That ought to flash in your brain. Oh, okay. Not that you could give it, but you need to pass that along to further medical people. I've never seen this in person. I've only seen pictures of it, and every picture I look at of angioedema, it's pretty strong. Some of the textbooks will say that a symptom of anaphylaxis is angioedema. I'd rather them pull that out and reserve it. If you'll notice, this publisher slide has no mention of lisinopril on here. So I think it's a disservice not to mention that. You've probably, or you should have at least heard the term stridor in your airway lecture. So stridor means what?
Upper airway.
Upper airway. Wheezing means lower airway, and crackles mean lung tissue. Lung tissue. Can you see all of those in anaphylaxis?
Yes.
Yes. Is that an indication that epi better be real close?
Yeah.
If not on board? Okay, good. There's your nausea, vomiting, abdominal cramps. Why do you have that? The body's just trying to flush. It's just hyperactive, getting rid of it. Are they shocky?
Yeah.
Yeah. If you're wanting to find shock as low blood pressure, then you've got your answer here. Yes, they are shocky. Cardiovascular collapse. So my last question about that would be, is it life-threatening? Is it life-threatening? Yes. Is it a dire emergency? Yes. So we hope this patient has an EpiPen close by, because even the 7, 8, 10 minutes to get an ambulance there to bring epinephrine may be too late, maybe too long. Once again, it's always funny to me when someone says they're highly allergic to peanuts and they'll go into anaphylaxis if it's just in the room with them. Where's your EpiPen? Oh, I left it at home. If you're that bad, you should have that thing strapped to you.
Is that like real?
What do you mean real?
Having an allergic reaction to peanuts with them being in the room?
Some people are that hypersensitive to it. That's why you see on the labels, food labels, this milk was processed in a factory that also processes wheat or gluten. Maybe just the dust on the wrapper. It only takes a small molecule of it that the body, as long as the body can recognize it, it'll go after it.
That's great.
Did y'all see where a lot of actual dairy milk was recalled because it had traces of almond milk in it? And if you're allergic to almonds and you're drinking milk, then they recalled all that milk because traces of almond milk in it. You know, probably the same factories filling jugs with all kinds of milk. I argue there is no almond milk. There is no almond milk as I know it.
Yeah.
Okay? I've never milked an almond, but I have milked a cow and I've milked a goat.
Nut juice.
Yeah, yeah. Good, Sterrett, good. Yeah, exactly. Nut milk. They don't advertise it like that, do they? Boy, we fall for marketing as a society so easily, don't we? So easily. It's so much better for you. Just look at the ingredients of soy milk or almond milk and the things that they have to put into it to make it look like milk. And it's like, that ain't even close. Ain't even close. All right, so if a common allergens, about 4 slides on this. Food is very common. Quick little story, I had a paramedic student during their clinical rotations. She rode out at a fire department over in Fannin County. That's where she done her clinical rotations. It was Thanksgiving break. She went out and done some. Come back from Thanksgiving break, she tells me the story. She said, I had an anaphylactic reaction, I almost died. And I was like, what? She said, yeah, right in the middle of my rotation. I'm like, what happened? She said, it was really funny how it happened. She said, I'm allergic to cinnamon. I said, how allergic are you? She's like, anaphylactic. I know, it's EpiPen time. She said, I just don't eat cinnamon and I'm fine. She said, we went to go have lunch and we walked into this cafe, home style cafe thing over in Fannin County. She said, as soon as I walked in there, I could smell cinnamon. And she said, smelling it doesn't bother me. She said, I saw candles burning. She said, I assumed that the cinnamon smell was from the candles because they had it decorated for Thanksgiving and the holidays. She said, I sat down to eat and we got the rolls and we're eating the rolls and then the chicken fried steak and all that. She said, I got into the chicken fried steak and started tightening up. She said, I'm sitting with 2 paramedics and one of them took a napkin and started fanning me. Like, you look like you're getting hot. Are you okay? She's like, and the other one said, we better get her back to the station. So they take her all the way back to the station and then she's in the back of the ambulance by herself. They open the door and they're like, oh shit. And somebody said, what's going on? They're like, get her some epinephrine. So one of the paramedics that were at the station is the one that identified this. The cinnamon was in the rolls and they went back to the restaurant and the woman that runs the restaurant was sprinkling cinnamon in the rolls for the holidays to give it a, an upbeat or a change in season or whatever, pumpkin spice latte. I don't know what's going on. But that's where she got the cinnamon. That's where she was smelling the cinnamon. They were baking it in the rolls, but it didn't call them cinnamon rolls. You know, they were just putting trace amounts in there to, that's how sensitive it is. And the funny part was 2 paramedics didn't recognize that she was going into anaphylaxis and threw her in the back of the ambulance. We better get her back to station. She's not feeling well. She ended up in the ER with multiple rounds of epi and stuff like that. Antibiotics, especially penicillin. A lot of these antibiotics contain proteins that are naturally derived. Erythromycin, penicillins, and stuff like that. You'll see a lot of those allergies out there. Not that we give it, but we have to pass the information along. Non-steroidal anti-inflammatory drugs like aspirin, Motrin, all your ibuprofens. There are people that are allergic to that. Specifically aspirin. So we don't give people aspirin, even if they need it, if they're allergic to it, because the anaphylaxis will certainly go ahead and kill them. Lisinopril, we just mentioned that one, causing that angioedema. A lot of medications. Morphine. I'll go ahead and tell you. I don't have to tell you, but I'm going to tell you just so you guys know this. There are a lot of people who are allergic to sulfa drugs. And sulfa drugs, you're allergic to sulfa drugs? Sulfa drugs is a class of drugs used as an antibiotic or an antimicrobial. Now, in the ambulance, I have a drug called atropine. And if I look at the box of atropine, if I pick the box up and read it, it says atropine sulfate. Okay? Or if I pick up a bottle of shampoo and read the back of it, it probably says it contains sulfates, unless you're buying a sulfate-free shampoo, and a lot of people do. Those words sound the same. They kind of rhyme. They kind of start out being spelled the same. They are not the same. I have had argument after argument with patients and paramedics alike looking at atropine sulfate and going, you can't give that to that bradycardic patient because they're allergic to sulfa drugs. You can't give them the atropine sulfate. I said, could I give them morphine? They're like, yeah, you can give them morphine. And I look at a box of morphine, it says morphine sulfate. My mother, if she ever watches this video, she'll be embarrassed. I guess she will be. She'll still swear up and down. My mother is allergic to sulfa drugs. And so when she buys toothpaste or shampoos and stuff like that, she's like, I can't have that. It's got that sulfa in it. I'm like, Mom, that's a foaming agent to make your toothpaste foam. It's not a sulfa drug. Can't convince her otherwise. Even though she's sitting there doing it with no problem, she just doesn't realize she's not, it's hidden. It's hidden. Did you brush your teeth today? Yeah? Okay, good. Good. You got some sulfate in you. Sulfate, that's more of a chemical definition. This is just a class of drugs that are used as antibiotics. So watch that one. If a patient is being adamant and saying, I am not taking that drug, then they have the right not to take that drug if it's based upon their perception of what that is. But you have also the ability, I hope, to explain to them this is not the same thing. But there are many paramedics out there who believe it's the same thing. So lack of education can be dangerous. This one looks, if I saw this kid, I'd be like, oh, damn. I'm expecting airway compromise and stuff like that. Remember when we classified drugs on how they got in the body? We started like under the tongue and topical on the skin, and then we injected them into the muscle, and then we injected the drugs into the vein through an IV. That route of administration depends on how fast we want the drug to work. Remember? Well, the same thing applies here in allergies. If it's injected to the body, you'll see it immediately. If it's topical or has to go through the GI tract, you may not see it for a while. Have you ever had a shot or taken a medicine in the clinic or the ER and they make you wait for a period of time before they release you and let you go home? If you have, that's what they're waiting on, to see if you have a reaction to this drug, because they don't want you driving down the road or getting home and having the reaction. Some people are sensitive to the plants, and we already talked about some of those. Remember, you can have allergic reactions, doesn't necessarily mean you have anaphylaxis. Doesn't mean we won't treat anyone that's just having an allergic reaction. We'll transport them with the rash and stuff like that, because we don't know how long it will take before they develop full anaphylaxis. There are certain medical procedures that still require latex equipment. You don't have to worry about that in the ambulance setting, but I'm just letting you know that it's still a rather big deal. Some of that medical equipment has to be made out of latex. Don't ask me for specifics, but you just can't build it out of nitrile or any other form. So that still becomes an issue. And then we talked about that. There's probably a test question, ding ding, how to remove a stinger from a bee. Scrape it out. Now, the textbook may say something like a credit card, but you can scrape it out with anything credit card like, hard plastic like. You're not to grab it and squeeze it and pull it out, because when the bee stings, they leave the stinger and it detaches from their abdomen, and what's left is the venom sac is on the end of the stinger. And that thing has a mind of its own, and it just sits there and pulsates and keeps pumping venom into the victim. So if the stinger's still there, you need to scrape it out with something like a credit card or a driver's license. Some people get really worked up over that. I had a student who, we weren't having class, but he was taking classes at the college on the day, other classes. He bust into the classroom one day, and another paramedic and I are sitting in the classroom messing with equipment or something. And this kid just busts through the room. And he's got his motorcycle helmet in his hand, and you can tell he's been on the bike. And he's like, ha, ha, ha. I'm like, what is wrong with you? He's like, I got stung. Okay. You're not having an allergic reaction. You're having a panic attack, but not an allergic reaction that I see. And he said, I got stung on the neck while riding a motorcycle. It went up under my helmet and got in my collar. And we looked, and you could still see the stinger in his neck. Well, my friend gets up and takes I don't remember what it was. It wasn't a credit card. Let me say that. And he went to pull it out, and the guy's like, you can't use that. You got to use a credit card. Dude, you need to calm down. But we looked at it, and that stinger was still just like bouncing up and down, just pumping the crap out of venom into his system. He wasn't even allergic to bees. He just thought he was about to go into anaphylaxis. So he took his knowledge and went too far with it. I think you call that a hypochondriac. One of those people, what do they call them? When you always think about doom, there's a word for those. What do they? Catastrophize. They catastrophize. Every little thing turns into a catastrophe. And that's the way he was. We use bees because bees are relatively common, and they're around flowers and they're around people, but don't forget the other stuff too. I know people who say they're allergic to mosquito bites. I'm not saying it doesn't happen, but I've never heard of someone who has an allergy to mosquito bites that looks like anaphylaxis. I've seen people that get the hives a little stronger and a little more swelling than maybe other people do. Not saying it doesn't happen though. But the general public takes this allergy thing and really turns it up very, very far, and kind of had to work your way through it. In half of these deaths, the victim had never experienced a reaction to prior stings. How come? Why not?
Because it only reacts on the second.
Yeah, it's repeated exposures that increase the sensitivity to it. I could say today that I'm a lot allergic to bee stings in that sense, but tomorrow if I got stung by a bee, I may be. I don't know what my immune system has done in the time since I was last stung by a bee. How many times has anyone here not been stung by a bee? Okay. Wasp? Been stung by a wasp? You haven't? No bee or no wasp? Oh, you're missing out on life. You haven't stumbled upon a yellow jacket nest? Bumblebee nest in the ground or anything, huh? You just run? Hunter, have you ever mowed over a bumblebee nest in the field?
Last year,
Can't get off the tractor fast enough, can you?
I shredded. I was on an open cab tractor. Just so happened to be that one field had a bee nest tree.
In the ground?
Couldn't get away from it neither. That's where I ran like a mile.
Yeah, you pissed them off.
When I was little, I was at baseball practice. I was like 8 years old, and I had an open can of Coke, and there was a bee at the
You took a drink?
I took a drink, and it was in my mouth. It stung the roof of my mouth.
Mm-hmm.
I was freaking out.
Yeah, yeah.
Last year, we have like way too much mulch on our property because my mom's obsessed with it and she uses it everywhere. So I was moving around with a bobcat and I scooped it and there was a gigantic freaking hornet's nest.
You can't get away when you're on equipment.
No.
Can't get away. Let me give you a tip of the trade, if you will. Tricks of the trade. A handy little tip. If you pick up a victim on the side of the highway or side of the road in North Texas, Southern Oklahoma, you will encounter fire ants. Fire ants are meat eaters. They like blood. They sense blood. They'll come at it. That's a meal. I had a guy that, I'll tell you how bad the fire ants are to patients. Had a guy who broke his femur in a motorcycle wreck, and he was using his foot as a pillow. So he broke the femur. When he landed, his leg was underneath him and he's laying on his foot. He's got a bone sticking up in the air, his femur sticking up in the air, and there's just meat and blood and stuff around it, right? And I could walk up and I'm like, oh, he's like screaming. And I'm thinking to myself, I really don't have real good pain meds on the ambulance. I got one and it's not real good because they didn't let us have all the good stuff we have today. We had one painkiller, and I'm like, sir, as soon as I get you in the ambulance, I will give you something for pain, but I'm going to have to move that leg. That will be the best thing, just if I get it back into alignment. He said, the leg, get our fire ants off my back. Because there was so much blood on the ground, I looked. What I thought was dried blood was just masses of fire ants. He just landed them. There are many reports of people getting drunk and passing out in their yard or in the ditch, walking home or something, dying from fire ant bites. It's just thousands upon thousands of bites. And then once we got him in the ambulance, they were just everywhere. And it was just if you are on the side of the road extricating someone, you're going to get into some fire ants, especially a day after it rains, right? They're just there. So, scene size up, BSI scene safe. I hope you're not allergic to fire ant bites because you'll get some because you're just standing in the ditch helping someone out of a car. Just call ALS, let them have it.
You're just spraying with a fire hose. Get them off.
I'll take it. I'll take it. So there are the little pustules that come up from the fire ant bites. What happened to her third dog there? And that one over there is rolling under. I was like, and she got a bunion on that one. I was like, damn. She's been wearing some, is that a she? She needs to shave that second. Okay, whatever. I'm not a foot person. I think I'd be a proctologist before I'd be a podiatrist. You know the difference? A butt doctor versus a foot doctor. Anyway, fire ants are pretty weird little creatures. They all get on you before they start, and they send that little signal out and said, "Everybody ready? Now!" And you're like, I didn't know I had all them on me. They will be on your patients if they're on the side of the road. Another word that you will see, I don't use this term, and I really don't know of many people who use this term, so I'm going to specifically point it out so you know what it is on a test when you see it, and it's called a wheal. To me, I call it a hive, but it's a little more whitish than a hive by definition. That looks like a mosquito bite to me. But they're called wheals. So don't be alarmed if you see that on a test. A wheal. What is happening under the surface of the skin at the capillary level? Go back to your other slides. What's happening there? Venom is being injected, and the mast cells are degranulating. And you get into tick bites and things that are into your parasite insects. They are injecting not necessarily venom, but enzymes that break down your skin, break down your cells, break down your vasculature, make it gelatin-like so they can sit there and drink your blood. So they're not injecting venom, they're injecting enzymes. And we can be allergic to those enzymes as well. And in doing that injection of enzymes, sometimes we get some bacteria and viruses that get transmitted along with them. That's where you get your Lyme disease, your Rocky Mountain tick fever, and stuff like that. So keep the little livestock off of you. Keep the little bugs off of you. Once again, insect stings can lead to anaphylaxis, and that's when it's upon death. So we'll kind of start repeating ourselves here. I'm going to go through this assessment because we need to be starting to work on our assessment. We started with it in our last lab, and we'll continue to develop that to where we're at the point where we're running an entire scenario or an entire call, calling in radio reports, moving patients, and doing things like that. So I'm going to start here with the scene size up, scene safety, and you're like, oh, that sounds kind of boring. When it comes to this stuff, you got to be super, super careful. Depending on the allergen or the antigen, you might be allergic to it as well. Went into a house one night and came back out, and because we left the side door on the ambulance open, we got back in the ambulance, and there had been a swarm of bees in the neighborhood, and they all went to the light, and the whole ceiling of the ambulance was just a swarm of bees. So we called animal control. The ambulance just sat there. We got a different ambulance because we weren't getting in it. So the scene wasn't safe, was it? You think, well, I'll get in my ambulance, everything will be okay.
Turn the light off?
Well, the lights were on. It was running, and the lights in the patient compartment were on. Well, we didn't go in. I've picked up patients covered in fleas so bad that they were hopping on us in the ambulance. It's a human being infested with fleas because their house is infested with fleas. You could back out and say the scene's not safe, but you're going to get questioned why. You're going to do remote calls out in the wilderness, in the woods, or side of the road, stuff like that. You're going to get exposed to ticks, insects, biting insects, mosquito swarms, and the like. It's going to be out there. Be careful of scabies. Scabies are highly, when I say infectious, contagious, meaning they invade. They invade easily. They replicate easily. Denison Fire had an infestation of scabies out of one patient. It spread to all 3 stations. It ended up causing them to destroy all bedding, including the mattresses. You had grown men shaving their entire body to keep the scabies, and they like to work on their hair follicles. Huh? No. Chiggers, when you get exposed to chiggers, what they burrow in, they bite, and they leave a little tunnel of that enzyme. And once they're fed, they fall off. You don't carry them with you. But that little tunnel's left, and it's irritating as hell. No, it's body lice. It's body lice. You may have heard it at the truck stop called crabs. When it's pubic lice, they call it crabs. So don't carry the little livestock around with you. Get rid of them. I will give you another deal. Be careful with the organophosphates that we use to get rid of those bugs, like rid and stuff like that. Sometimes that's as bad as the bugs, and the bugs are immune to it anyway. But when people get little bugs on their body, they run for any poison they can find to get rid of them. Most people freak out. Don't freak out. Don't freak out. It's not that bad. I wouldn't want to sleep with bed bugs either. Be careful what you're going into. You'll stand in homes to where you're having to do this so the roaches won't crawl on your feet and legs. You'll flip a light on into a room and you'll see roaches run behind a painting on the wall. Roaches are gross. Roaches eat on human flesh and hair. And there's a lot of flesh and hair left in a home that a human lives in. So be careful with that. Be careful with the scene. It's not always safe. Forming that general impression. So if they appear anxious and they've got those hives and those wheals already breaking out on them, is this a high-level patient, even though they're not experiencing true anaphylaxis yet? Yeah, high index of suspicion. ALS? Am I going to summon ALS in my initial size up? Probably so. What else will I start looking for real quick in a sample history setup? Allergies and what medication do I want? That I want. If I see somebody when starting to break out in hives or wheals and itchiness and watery and urticaria all over their body, do you have an EpiPen? Remember, at the EMT level, I can help you give it. If not, and my protocol says I can give Epi, then I need to be thinking about how I'm going to get that drawn up and administered to them. So very early in the primary assessment, I could already start looking for the epinephrine. Okay? Once I see this could be an anaphylaxis, I don't want to have to go looking for it later after it develops. Doesn't mean I'm going to give it right now. Just means I need to look for it. Does anyone know of anyone wearing a medical ID bracelet or necklace? Do you know of someone who is? Do you know what it says on it?
My grandma wears one because she's allergic to morphine.
Allergic to morphine? Just not. I got one person here. Anybody else know of anyone wearing a?
Well, I know diabetics wear them.
You know, we always say look for it, but I rarely find it. It's, not necessarily an attractive piece of jewelry. I've seen it so infrequently that I've stopped looking for it. And that's a bad on me. I should always look for it. But look for those bracelets or those necklaces, and they may tell you what's going on. It's really hard to get a kid to wear one. And we already know about the airway and the breathing, and that's a part of the primary assessment once again. If they're stridor, we know we're behind the curve already. Wheezing, we're behind the curve already. Could you use bronchodilators like an albuterol here? Sure. But it's not going to fix what? What will albuterol not fix that Epi will fix? They'll both fix the lungs. Huh? Yeah, it won't fix the vasoconstriction, will it? Because remember, albuterol is beta 2 selective. So it has very little effect on the heart or the vasculature. Epi gets all of it. So if that's all you see is airway issues, blood pressure is still good, pulse is still good, you might call med control and they may want you to use a nebulizer. We know what bad breathing looks like. I think oxygen is certainly warranted here. We need every chance we could get before they go into complete airway failure. You can assist them with this. If they have that rapid pulse and cool skin, you already know that hypotension has probably started in even before I take a blood pressure. In a primary assessment, I'm not getting a blood pressure cuff out. I'm going to do that in a more detailed en route secondary assessment. I've heard teachers say, you need to get a blood pressure before you leave the scene. No, I don't. No, I don't. I can get the blood pressure later. Right now, I know it's not good, and I'm not basing my judgment on blood pressure readings. I'm basing it on patient presentation. Please understand that. There are people who also try to teach down this sheet, this patient assessment sheet, that is not even available on the National Registry website anymore, by the way. These are copies of copies of copies, and when they're all gone, I don't know what we're going to do. If you teach assessment through this method, going down and hitting the check boxes, you can take a third grader or fourth grader and say, memorize this, and they can pass the skill station. All they got to do is look at a mannequin and go, BSI scene safe, mechanism of injury, I'll determine number, how many patients do I have? And they never look at the patient. These are trash. These are trash, but people still use them. And if they do, I guess that's okay. I may never leave the primary assessment. What do I mean by that? I may never do a secondary assessment. How? Is that, do what now? Yeah, if I've got an airway issue, I'm going to work to solve it. Stop, time out, solve the airway issue. If I get it resolved, I can move forward. If I don't get it resolved, I'm stuck there. I may never leave the primary assessment if I'm still trying to work on airway, breathing, or circulation. Are you with me on that? You can't say, well, I can't get the airway in because you got angioedema. Well, let me just go ahead and take your blood pressure and look at your toes and see what they look like. I don't do that. I stay with it till I resolve it and then move forward. In these patients, how often would I go back and reassess those airway issues if they're present? At least every 5, no longer than that, probably 3. Probably 3. Definitive treatment for anaphylactic shock or an anaphylactic reaction is epinephrine. Where am I doing this at? In the primary assessment, yeah, that's the route I'm giving it. I am. But I'm not waiting to obtain a set of vital signs. Am I? Can I give the epinephrine based on the wheezing, the stridor, the pale, cool skin, the rapid pulse? Because I walked up to him and said, you doing okay? And I'm like, his pulse is 182. It's like, it's fast and his skin's cool and he's got hives. Do I have to get a blood pressure? No. What happens if I wait till the blood pressure falls real low? I'm way behind the power curve. So please, don't let the test get you. If they need epinephrine, they need it as soon as you can get it. You don't have to go into the detailed exam to give it. They'll trick you on that, so be careful with that one. Transport decision. Do I go with these patients? Most oftentimes I do. If the epi resolved the issues, do I still go with these patients? Yes, because epi comes off really fast. Do I repeat the epinephrine if they have 2 EpiPens? If it's warranted, I do. If it's warranted, I do. Yeah, I think at the EMT level, most specifically, I'm going to move these patients. Probably at the paramedic level too. So kind of a big overall, how does this patient look if they're having an allergic reaction? And I think we've kind of worn this out already. Give you a chance there to kind of look over it. Is there anything in here that causes you a question, or is there anything on here you can't explain where it comes from? If I was to point out gastrointestinal problems like nausea, vomiting, and cramping, can you tell me why? Then, okay. If I tell you they have tightness in the chest or throat, can you tell me why? Okay.
What's pallor?
Pallor? Good question. Anybody? Pallor.
So cyanosis
Pallor.
or pallor around the lips.
Pallor. P-A-L-L-O-R. Good question. I'm just wondering if anybody else can answer it before I do.
On the
Some
Pallor.
Skin, like the last one, second to last.
Cyanosis or pallor?
I'm guessing it's a different color, right?
Well, cyanosis is the blue. Yeah, it's pale. Why didn't they just say that, right, Jess?
Yeah.
Why didn't they just say pale? Pale, pallor. I don't know, Luke. I don't know. Why does a black cow eat green grass, drink muddy water, and give white milk? I don't know. Could have made it easier in this, couldn't they? Could have made it easier in this. How do you find cyanosis or pallor on a black-skinned patient?
mucous membrane.
Mucous membranes. Pull their eyelids down. Yeah. Nail beds. Anything else on here that you don't understand or know where it comes from? So you think if you're eating Thanksgiving dinner with that girl who had an anaphylactic reaction, you could recognize it in the restaurant and not use a napkin but use epinephrine? Okay. Okay. How many times have you seen, and if you're in the hospital, you've probably seen it a lot more, but how many times, let me go get you a wet rag? Like, that's the cure-all for everything, isn't it? Grandma's wet rag. All right. Just going on along here. I hate teaching assessment in this method, and that's why I do not, but I think we get it. Every 5 minutes because it's serious. Document, 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 document. There's that credit card. Scrape out the stinger if you see one. Do not squeeze it.
Why wouldn't you just get a pair of tweezers and try to fix it?
Because you're gonna squeeze
Because
it.
you'd squeeze it.
Yeah.
You'd get it out, but you may squeeze the venom sac and just go ahead and empty it.
If they are allergic,
Dude,
then-
I'm with you. I'm with you. I'm with you.
It's already in there.
But it'll scrape out. It's like, how do you pull a tick off? You pull it off. There's a lot of wives' tales about that. Just pull it off. Don't burn it. Don't drown it. Just give it a constant pressure, and he or she tick will release their mouth and pull out. If you burn them or suffocate them with baby oil or something like that, they tend to vomit, and you don't want the contents of that vomited into you. They'll release. Just pull on it. How do you get it off? You pull it off. It's real simple. People make things real hard. Remove jewelry. Why would we pull the jewelry off? Well, we don't want it to swell and get stuck on there. Position the injection site below the heart. May or may not work. That has not shown to be. Do not apply any constricting bands or stuff like that. We'll talk about that more in snake bites. Monitor the patient. All right. We know about epinephrine already, so we're beating a dead horse here. Try to get through this by 11, and then we can talk about some other things. EpiPens are about $700. People are reluctant to buy them. That's why the state of Texas has allowed the medical directors to give you the option to draw it up yourself. So if you work in that environment, please get yourself familiarized with that. We did that one day in skills lab. Do you think that's worth repeating again now? Okay. Okay. We'll have that section one more time. When we come back from break, I'm going to show you a little math on how to do that, just so I know that you can understand how to draw it up, okay?
When we do our clinicals, we're out do we do any of that? We just watch.
If there's an EpiPen, they'll probably have you do it.
What about drawing
Probably not. They're probably not going to let you because of the EMT level. And not all, I mean, the textbook doesn't show you how to do it. It's really not necessarily in the national scope of practice. It's just that medical directors in Texas can give you that protocol to do it. But
I was going to ask you, Denison was telling us, one of the Denison guys, saying there's a form of, not an advanced airway, but a different airway that we haven't talked about at all, that the EMTs are doing.
the LMA, the LMA,
Will you teach us how to do it?
yeah, before we're over, I'll show you. There's a lab day that I do that's just called ALS Assist Skills. And it's just how does the EMT help the paramedic with their skills? And we'll do some of that. I would know, ding ding, the dose of adult epinephrine and child epinephrine. And we're about to reinforce that when we come back from break and do our math. Do a little math. But that's on the test. How long do you hold that pin into the thigh? 10 seconds. Honestly, it's in there in about 0.10 seconds. It goes in really quick. But hey, we gotta make it complicated, don't we, Luke? Hold it for 10 seconds. Is the thigh the only place I can give it? Nope, that's just where the patients, there's a big muscle there, and that's how the patients are taught to administer it. Remember, that's meant to be given by self. You can give it in the deltoid. We know what the effects of that are, so we won't beat that to death. It's going to make them jittery. It's going to raise all that. And we hope it raises that stuff up. So who gets it? Allergic reaction or anaphylaxis? Anaphylaxis. Ding, ding. That'll be a test question as well. They'll give you a patient presentation. The patient's airway's clear. There's no abnormal sounds, no stridor, no wheezing. They've been stung by a bee on the leg, and you notice swelling around the sting. Are you going to give epinephrine? No. Stridor, wheezing, pallor, cyanotic. Is that enough to give the epinephrine? Yes. Okay. Sounds like you got anaphylaxis figured out.
What if they haven't got to that anaphylaxis point yet, but they've been stung before and they go into anaphylaxis? Okay.
Well, yeah, I don't want to give it early because it's going to fast off. And remember, the epinephrine's not stopping the degranulation of the mast cells. So I don't want to waste it till I need it.
Just wait till they go in there.
Wait till I wouldn't wait like, let me get the definitive blood pressure. But as soon as there are signs of airway or cardiac compromise, yes. Yeah, it's a little judgment call there. It's a little judgment call. Time is to our advantage, though, because if it's progressing, it's probably already progressed by the time we get there. Depending, though, did they eat the allergen or is it injected? If it was an injected allergen and they're not having anaphylaxis upon my arrival, probably aren't going to have anaphylaxis. Probably. But if they've eaten the peanut, it may be 20, 30 minutes before they do it. And I'm not going to give the epi just because they ate the peanut. I need to see it developing. Riley, it's imperative that I take roll today. Who's absent? Anyone? Is anyone absent, Riley? I have to take roll when we come back in, because if they were absent on drug screen day, they have 48 hours to get to Plano. Dang.
Oh, I almost thought about sleeping in.
Dang. Yeah, it wouldn't have been a good idea. Wouldn't have been a good idea. All right, signs and symptoms of allergic reaction are caused by the release of what, Gus?
Histamine.
A?
Yes.
Final answer?
Yes.
Chas, you agree? Do you agree? I don't know if I agree or not. Frank, do you agree? Stare it?
Yes, sir.
Y'all don't listen.
I didn't want to sound stupid.
You didn't want to what?
Everybody was saying A, and I was like,
I was like, wait a minute.
Did I say leukotrienes? When I talked about degranulation of mast cells and we had the picture up there and I said the chemical mediators, specifically histamine and leukotrienes? Can we get a replay on that?
I remember hearing that word, but
Okay. Have you ever watched a commercial on TV for one of these allergy med things? And they say it's a leukotriene inhibitor. No?
I don't watch TV.
You're a smart man.
I don't watch commercials.
That's where you learn pharmacology. Yeah, that's where you learn pharmacology. Number 2, the negative effects associated with anaphylactic shock are the result of what, Riley? The negative effects associated with anaphylactic shock are the result of C. C. Amber, do you agree? She said C.
Where's all the above?
Yeah, right. So,
You think so?
that sounds right.
Might be B.
I was just looking at the letters. I have no idea what it was.
Not quite.
Riley,
B and C. Yes,
Sure.
you still staying with C?
Yeah.
Not changing your mind?
No.
No amount of money will make you
No.
good. Good. Good job, Riley. You're called to a local baseball park, Luke, where a 23-year-old man with difficulty breathing states he ate a package of peanuts 30 minutes ago and denies allergies or past medical history. Widespread urticaria, tachycardia, BP 90/60. He's wheezing even without a stethoscope. You can hear it. You should be most suspicious of
Charlie.
Huh? Charlie? C? Could it be A?
It's already past A
Why?
because he's wheezing.
Yes, urticaria.
It can't be A.
Oh, he's got the hives and the urticaria and the low blood pressure. May not be. Could it? Without that, could it be asthma? Can asthma be induced by an allergen?
It was there.
Yeah, it's very plausible, isn't it? It's very plausible, but he's got the associated symptoms. He's showing signs of cardiovascular collapse, so that's why you went with C.
Well, the timelines of symptoms. So.
Yeah, and the giveaway was the peanuts, right?
Take away the peanuts.
Yeah, take away the peanuts and just a guy hanging out there.
How would you identify that was anaphylactic?
It's a good question. Here's how I would answer that in that sentence. This goes for all of you. If I didn't have the peanut clue and I wasn't studying anaphylaxis today, and I just got called to the ballpark, 23-year-old man, difficulty breathing, everything else reads the same, I'm still going to go with C. Why? It's because it's the life-threatening one. It's the life-threatening one. So that's that old rule. I'm going to think of the worst possible scenario. That way I'm covered. Does that make sense to all of y'all? Okay. So when you see a question like that, and you're kind of like in the air, it's like, well, which one of these four is the life-threatening one? They all could be, but that one right there, when you see the word anaphylaxis, you should think life threat. So I won't be suspicious of that. Remember that list on the board until I rule that out, until I get that off the list. Number 4, what is a wheel? Gus, what's a wheel?
A.
A?
Yeah.
Sure it's not B? What's B?
The angioedema.
Very good. Very good. What's C then?
Hives or
Okay.
Urticaria.
You got 5 questions out of that one, didn't you? Number 5, you're treating a woman who's stung numerous times by hornets. On assessment, Nate, you note that some of the stingers are still embedded in her skin. You should.
D, cover the stingers with tight dressing. B.
Scrape the stingers from her skin. Yes. Number 6, Amber. Young male is experiencing signs of anaphylactic shock after being stung by a scorpion. That means he's been stung twice at least by scorpions, doesn't it? Bad luck in his house. Level of consciousness is diminished. His breathing is labored. You hear inspiratory stridor. His face is cyanotic. He has a prescribed epi injector. What should you do?
Assessed him with Lily within
Yeah, we need to get that in him.
Would you assess him at his level of consciousness is diminished, or would you
Just do it. Just do it.
Was it?
What's wrong with C?
I'm going with D on this one.
Yeah, straight.
What's wrong with C?
You're not getting through the reaction.
He needs
You need the epi before you go to open the airway.
You need
Isn't it
to-
A, B, C?
Well, sometimes it's CBA.
And that's in cardiac arrest.
I said sometimes. I didn't say it's for this. I just said sometimes.
Okay, you're right. You're right. You're right. But he's decreased level of consciousness and he's breathing very bad and he's cyanotic. Why are you not assisting his ventilations?
Is the epi-
He's having an
Takes 10 seconds.
Because I give him epi first and then, why can I?
You don't get the after the airway closed.
If I'm doing an assessment and I just told you that if I'm going down the ABC primary assessment and I run into trouble, I need to stop and address that trouble.
Yeah.
So why am I not using my back valve mask and helping him breathe since he can't breathe very well on his own?
Is the background valve going to fix that?
It's not gonna fix the swelling.
You're fighting against the swelling the whole time.
Just give the epi and then start banging.
That's what I do though.
Takes 2 seconds, 7 minutes.
That'll kill him faster. Right.
I was with you.
We'll just call ALS.
I was with you. I agree. I agree.
You sure about that?
I
You
agree.
think we should have give epinephrine first?
Here's the deal. This is a question that would never make it to the National Registry.
Thank God. But I mean, it takes 10 seconds.
Yeah.
Max.
But
You could do
But-
both at the same time pretty much.
that's kind of like the old question that I used to argue with the military guys about this a lot. The civilian medic and the military medic. The civilian medic will address somebody not breathing while the military medic will address the bleeding. What good's an airway if he loses all of his blood? And I said, what good's it saving all of his blood if he doesn't have an airway? It's just like, come on, right? Come on, right? Do you have enough sense that you and I could sit here and have a debate about what we should do first? Do we know that epi needs to get in him? Yes. Do we know that we need to support his ventilations and help him because he's labored and tired? Yes. Don't ask me what comes first, chicken or the egg crap. Just say, I need to address both of these. This will be much, much better once the epi's on board. You could. I mean, you could.
How long does it take for epi to start relieving symptoms?
That was real quick, like real quick. It's almost like I need to get this in him. You're not by yourself either. I hope. I hope you got a partner. Hey, get that epi in him while I get ready to ventilate him. This question would be massaged and reworked at the registry level to where you got a better outcome. Will y'all forego break and just let you go early?
Yeah.
Okay. Number 7, the most reliable indicator of upper airway swelling during a severe allergic reaction is what?
Schreier.
Y'all didn't even let me pick anyone.
We all Don't do it.
And wheezing.
You hope it's Strider, don't you? You're gonna revolt and walk out the door. The most common trigger of anaphylaxis is what?
Chemical. All.
Actually, I don't know.
Whatever they're allergic to, actually.
What does common mean?
Most common trigger. I'm gonna have to think about this a minute. Think it's food? What's Siri say?
Food allergies.
Food?
Yeah.
But 90% of the population's on medications every day.
It says food allergies and then stings.
Yeah, but 100%
She's right.
of the population is food.
She's right. Number 9, the adult EpiPen delivers
30.
No,
Point
it's
30.
like
It's a B.
It's B.
and the infant is half of the adult. Everybody agree on that one?
Yep. Ten.
10.
B.
Y'all got the trivia out of the way. Let me show you one thing, and then let me show you one thing. I think everyone in that lab setting saw that vial of epinephrine. Did you not?
What?
It was in the bottle.
What is that?
During your lab, you saw the vial of epinephrine.
Oh, yeah.
It's in that bottle. That bottle, that big bottle held 30 milliliters. That's how much was in that bottle, 30 milliliters. If you saw a little bitty, if you saw a little glass one that you broke the top off of, it probably had 1 milliliter in it. Let's just go with this vial that's got the 30 in it, okay? 30 milliliters. On the label, it said Epi 1 to 1,000. Epi 1 to 1,000. That, in that form, that's Epi for injection. When we're in cardiac arrest and somebody's pulling out a pre-filled syringe and they're giving epinephrine that way, they're using a 1 to 10,000 solution. The only difference between this, 1 milligram of epi, this 1 milligram of epi, is this is 1 milligram in 1 milliliter of water. This is 1 milligram of epi in 10 milliliters of water. It's just diluted. Does that make sense? Yeah. Okay. I could actually pull up 1 milliliter out of this vial, add 9 milliliters of water to it, and make that concentration if I wanted to. It's kind of like Tide Pods versus the old days where you poured up a big cup of it. This is the one you want to use. Could you use that one over there? Yeah. You could, but 10 milliliters is a lot to give into the muscle as an injection. 1 milliliter is not so bad. So this one's real easy. So I have a supply, that's the supply, that has 1 milligram per every 1 milliliter I pull out of there. The total volume of it's 30. But I only need 1 milliliter out of it, maybe not even that much. It just means if I pull 1 milliliter, I get 1 milligram. Yes?
Why don't they make refillable EpiPens?
Because,
They lose too much money.
well,
Needle's already exposed.
needle is exposed and, yeah. Well, I'm showing you how to make an EpiPen right now, okay? Because you can go down to Tractor Supply and buy this. Because if you're vaccinating animals, they tell you to have Epi on board in case the animal has an allergic reaction to the vaccine. So this is the supply. I always compare the supply to the order. So I'm going to use a little equal sign there. I want some amount of Epi and some amount of volume that's still equal to a 1-to-1 solution. So what'd you say the adult dose of epi was?
0.3.
So no naked decimals, 0.3 milligrams over X. So I need to know how many milliliters I need to pull out of this vial to get 0.3 milligrams. Knowing that if I pull 1 milliliter out of the vial, I get 1 milligram. Pause. The equal sign doesn't lie. If 1 is to 0.3, what is 1 down here to? 0.3. There's only one number in the world that would make that equation true, right? Now, if it wasn't that cut and dry, I could cross multiply 1x. 1 times x is equal to, what's 1 times 0.3? 0.3, right? Any number times 1 is itself. So, yeah. So if I pull out 0.3 milliliters from this vial, I will have the equivalent of an adult EpiPen, right?
That's a lot of doses.
$7.
Exactly.
$12.
Versus
Inflation, let's call it 20. Uh-huh. How many EpiPens are in that vial? 100. It's 100. There's 100 EpiPens in there for $20. Not counting the price of the little syringe and needle. So if I've got a pediatric and I want 0.15, how much do I draw out of here? 0.15 milliliters, right?
Wait, what? Or 1.5?
0.15 milliliters.
That's marked on the needle.
That's marked on the syringe.
On the syringe.
If you use a small enough syringe, you can't use like a 60 mil. It's not graduated that small. It's overkill. You want to use that small little 1 milliliter syringe, and it'll be graduated in that. Easy enough, isn't it? You just saved yourself a lot of money, didn't you? What's the disadvantage of doing this, though? Well, you're not going to carry that around.
Take the time to draw
Yeah,
it
it takes time. It takes time. You're not going to teach 8-year-old Johnny how to do it.
And if you forget your numbers, you can screw up real bad.
Do what?
What happened if you use somebody too much?
All those reactions that you know of, side effects, will just be profound.
So what if you give like 1 milligram?
I give 1 milligram to a dead man, someone who's pulseless.
So what does it do to a lot, man?
If I injected you with 1 milligram of epinephrine right now, your heart would race, you'd get clammy because your vessels would contract. You'd be ran up for a little bit. You'd be very anxious. It would feel like you ever gotten like way too much caffeine on an empty stomach or anything.
No.
Drink a pot of coffee in the morning without eating or something. You just get that nausea. Just that's how you'd feel. That's how you'd feel. I will say this: a common injury among healthcare workers, I say healthcare workers, is auto-injecting epi in their thumb. When they take up that EpiPen and use it, they got it turned the wrong way because they're all freaking out, and they jab it in their thumb instead of into the patient.
I've seen that happen firsthand.
Firsthand?
Yeah, it was
Somebody-
mine. They clicked on my EpiPen and it went through your thumb.
Then the little thumb gets all jacked looking. We had a nursing student here do it. That's why we don't really have any real ones.
And the live ones.
I know where some live ones are, but we had a nursing student put the needle through her thumb. So, not a big deal unless it's been in someone else. All right, so when's our cardiology exam? October 2nd.
Next Wednesday.
Next Wednesday.
In class.
In class. In class. It's in class.
How many questions?
70.
Oh, so it's on Lex long.
So we already
Your study guide's out there.